Hello, everyone. My name is Gary Cohen, and I am the co-founder and president of Healthcare Without Harm and Practice Greenhealth. And today I'm going to talk to you about the Practice Greenhealth experience. We're realizing now, over the last couple of years, as the climate crisis has accelerated, that it's the greatest public health threat we face on the planet. And that the healthcare sector itself is part of the problem. In the United States, the US healthcare sector is responsible for almost 10% of global greenhouse emissions. And if healthcare was a country globally, it would be the 5th largest greenhouse emitter on the planet. So healthcare has this enormous responsibility because it is the one sector committed to healing. It's the one sector that operates with an ethical framework to do no harm. It has enormous responsibility to address climate as a strategic imperative. Fortunately, the momentum to do so is upon us. This is clearly a moonshot moment. In the recent climate negotiations in Glasgow in the fall of 2021, over 50 countries signed on to a health program to commit themselves to build climate resilient healthcare systems, and 15 of those agreed to decarbonize their own healthcare systems. In the United States, there was a new Office of Climate Change and Health Equity that was established that is committed to decarbonizing the healthcare sector. The National Academy of Medicine has launched a collaborative to decarbonize the healthcare sector. And just on Earth Day in April, the Department of Health and Human Services launched a pledge initiative to mobilize the healthcare sector to reduce its emissions. So the political momentum to get the healthcare sector to adopt climate action as a core to its mission is fundamentally now at play. And now I'd like to introduce Iqbal Mian, the Director of Sustainability Solutions for Practice Greenhealth.
Thank you, Gary. I'm incredibly excited to have a conversation with each of you since it's not always convenient to meet, especially in person. And therefore, let's welcome you to our partner model. And in a previous communication titled Unlocking the Power of Practice Greenhealth Partnership, we've been able to learn from our growing network that successful sustainability implementation requires upfront strategic planning, governance, and structure. So you can see here through this nice visual map that our community and network has grown to over 1,400 partners. That represents 25% of the healthcare sector, and 17% of that growth is just in the last 2 years. This is why we're focusing on strengthening the healthcare fundamentals aimed at building internal capacity at partner organizations to accelerate performance for greater transformation. While having successful one-off projects is not meant to diminish efforts, the greater sustainability evidence is when there's a culture of sustainability practices across the organizations and into the community. This is the aim that you're seeing in the Practice Greenhealth experience in year 1. This visual, you can clearly see that there are dedicated touch points and resources designed to empower our partners as they work with strategy managers from Practice Greenhealth. The Sustainability Program Fundamentals Assessment on the left is a key step into gaining insights and charting a path forward that promotes capacity and capability. In other words, we're trying to socialize sustainability by engaging the right stakeholders, hiring the right dedicated full-time equivalents, and creating structured mechanisms to enable performance and programming. Strategy managers in this cycle will help partners address structure and governance opportunities, which you'll see charted along here. We've made it very easy for our partners to access templates, examples for policy building, charter development, and SMART goal setting. This includes job descriptions from a medical director of sustainability to a sustainability program data analyst, along with organizational charts. All of this can be found in our landing page and within our sustainability program fundamentals. Moreover, on the left, you'll see that strategy managers will connect monthly for additional planning, reviewing tactics, strategies, KPIs, and looking at the progress in the fundamentals, as well as channeling stakeholders into dedicated experiences like our cohorts. And as internal expertise builds, the sustainability program strengthens. And that's where, on the right-hand side, we get very intentional about getting ready for our data and awards collection. And for those of you that are familiar with our 2021 benchmark report, you know that we've got 80 pages of detailed data tables across our 11 impact areas. And this is where strategy managers and our partners will level set with data-rich opportunities. And at the end of this stage, our partners are able to confidently outline sustainability goals, priorities, and deepen the performance with the transition to a new sustainability strategy manager for the year 2+ experience. And in healthcare, we get so busy that it's hard to take a moment and celebrate all of the work that goes on into governance. And so I just want to say congratulations and thank you for taking the time to make the business case, develop the executive and clinical champions, and also just to give the stakeholders the time and permission to mobilize on sustainability SMART goals. So let's roll up our sleeves and take a look at the year 2 experience and beyond. This is where, on the left-hand side, you'll see strategy managers are now moving to quarterly strategic calls. And of course, you can still access them anytime through email. But the focus is to spot check on implementation, look at the strategic plans, review metrics and KPIs to ensure forward progress is happening. And you'll even get insights into engagement, like the number of participants in partner experiences, including the Physicians Network, the Nurses Climate Challenge, and our cohorts. And of course, there's going to be greater opportunities for peer-to-peer networking that accelerates the sharing of best practices. And our menu of resources, like the Sustainable Procurement Guide or the Scope 3 Emissions Accounting Tool, they're not just references, but an opportunity for expert guidance and problem solving. And when you look in the middle, you'll see that partners can take advantage of the awards data platform and the benefits return in the form of benchmark report cards that provide foundation for goal setting and measurement. And each hospitals get a report card that provide an annual snapshot against a wide variety of percentile comparisons. All of this is so that strategy managers and our partners can collaborate to verify performance against their sustainability plan, goals, and priorities to make the right adjustments, recommendations to senior leaders, and provide additional support for key stakeholders on initiatives like the Cool Food Pledge or Race to Zero. We're looking for clear signals in achieving goals and transforming operations. Our proudest moments in this stage of Practice Greenhealth experience is actually witnessing our partners and their system capabilities improving to the point where goals are achieved and they're reported out into the community, and you're experiencing co-benefits like employee retention, recruitment, and hearing that sustainability is part of workplace culture. So while it may look and feel different, the partner benefits that you're seeing are going to be enhanced and the same. But by now, we hope that it's very clear that the Practice Greenhealth experience is designed for strategic impact. And at Healthcare Without Harm and Practice Greenhealth, our overarching goals are protecting the public from climate change, transforming the supply chain, and building leadership for environmental health. So our collective work in this model helps to move the needle on these overarching goals. And as Gary Cohen once said, we're just getting started, and our network is making meaningful progress, not just for the healthcare industry, but also for the patients that are in these communities across the globe. So thank you for being an active part of our network. And when you have questions, feel free to ask your strategy manager, and we'll be happy to continue the dialogue. And we look forward to working with you.